Hello, the purpose of this video is to explain how we treat trigger finger, including surgical and non-surgical techniques, risks, and potential benefits. I will also answer some of the common questions that are typically asked by the thousands of patients who I have treated over the years. There is additional information available about this and other hand and arm conditions we treat on our website at floridahandcenter.com. Trigger finger is a condition that affects movement of the finger. With trigger finger or tendinitis, patients will have a combination of the following symptoms. 1. Locking, clicking, or the finger actually getting stuck. 2. Tenderness or pain in the palm or finger. 3. Stiffness or difficulty bending or straightening the finger. These symptoms can occur in one or many fingers. We are uncertain why people get this problem, and it is often confused with arthritis. In many cases, the patients have both problems. Cortisone injections are very effective for trigger finger, and it is extremely likely that we have attempted this on you. If the symptoms are not completely and permanently relieved by the shot, then surgery is strongly recommended. Untreated or incompletely treated trigger finger will often lead to joint stiffness. This is a serious problem that is better avoided than treated. Treatments for stiff joints are generally not very effective. We have been performing trigger finger surgery in our medical office since 2004 and have hundreds of happy patients. This is a procedure that nearly every other surgeon performs in the operating room, but I have been successfully treating patients in a surgical suite at our office for over 6 years. By doing this in the medical office, we save the patients time and money because we realize that both of these are very important. An injection will be given to numb the area at the base of the finger. The procedure is actually done in our procedure room. The hand is cleaned with an antiseptic scrub, and a very small incision is made in the palm in order to identify the tight tendon and tendon sheath. The tendon sheath is then released and a single stitch is used to close the incision. The use of local anesthesia ensures that the procedure is done safely and quickly. No fasting and no complicated preparations are necessary. Many patients will feel an immediate difference after the release is done. You are able to move the finger immediately and have only very simple instructions. The bandage is removed after a couple of days and the tiny incision is covered with a Band-Aid. Many patients are able to return to work the day after surgery. We have not found the need for any prescription pain medication. Like any medical procedures, there are no guarantees and there are some risks. These include infection, tendon, artery, or nerve damage, and poor healing. Fortunately, these risks are very uncommon, with more than 95% of patients very satisfied with the procedure. The most common problems we see with this condition are a result of the patient waiting too long to have it treated. Relax. I take this and any procedure very seriously and will do everything I can to assure you have an easy experience and a quick recovery.